Oh, here we are.
Oh, we're live.
We're live. Woohoo! Welcome to another Wednesday Wellness with Rise Wellness Chiropractic.
Hello.
Dr. Annie.
Dr. Rachel.
And we are going to talk about birth trauma today. We've had a couple of kiddos this week that had pretty stressful births. So even though they were like all natural, unmedicated,
Good pregnancy,
like lovely births, we still see sometimes some birth trauma and some stressed out babies afterwards and stressed out parents.
I'd say we definitely still see.
Yeah, we definitely.
I would say sometimes.
Yeah.
It's very rare not.
It does happen. Yeah.
Yeah.
So we just wanted to talk about that today because it all kind of starts with what we talked about last week was Webster technique, and so some of that birth trauma can start with intrauterine constraints. So that's kind of where we wanted to start off. So picking up from last week, we talked about balancing mom's pelvis to help with baby's position.
Yep.
In utero, and also help take extra pressure off because if there's subluxation or misalignment in the pelvis, then it's going to affect how the uterus or how much tension is in the uterus and in the right ligaments. And
So yeah, if baby's not in best position, obviously it's going to cause issues for labor, delivery, but can cause issues to baby. It can cause like the first subluxation in the uterus.
Yeah, exactly.
They're all crammed in there.
Yep.
Awkwardly.
It also affects like how well baby can align with the cervix and stuff too. So like if mom's not dilating, if labor's not progressing, those are also factors that show up with that. But so then when we talk about baby coming out during the birth process, during labor, so contractions are happening.
Contractions are happening.
So babies, hopefully like this.
All right. Okay.
Yep. So they're like this. So as mom's uterus starts contracting, it's pushing pressure down on baby's sacrum, and their head is up against the cervix, pushing down.
So what helps it dilate?
Yes, that's what helps it dilate, but also it puts a lot of pressure up in baby's neck. So pressure up at the top of the neck, pressure up in the upper thoracics, and then there's also pressure happening in the sacrum too. So baby is kind of like the what's opening the cervix and also what's initiating labor.
Yep.
So there's a lot of pressure from that. Also, as baby is going through the pelvis.
This poor baby can't fit through
Yes.
the pelvis.
Yeah. So we're not even going to try to make that happen.
But we can see
yeah.
the baby was coming not positioned well. How can we see that?
Yeah.
What would be the good way to see that for them to see that? How they'd be pounding on like the pelvis there if baby's not positioned well.
Yeah. Or shoulders get stuck or whatever.
Or if like hips were misaligned. So that could cause some issues for baby. But also perfectly positioned going through, there's gonna be stress on that
stress
baby's
on the upper
spine,
cervical,
nervous
upper
system.
thoracic, and sacrum areas. That's where
Makes
we
you know how much stress is it on there? Do you remember?
60 to 90 pounds.
60 to 90 pounds of axial torsion, twisting.
Yes, so that's as like baby's coming out. When OB or midwife or whoever's like helping deliver the baby helps pull baby out, there can be a lot of traction.
Yeah, 60 to 90 pounds. That's like literally taking a baby and holding it by its head and putting a 60 to 90 pound weight on that baby's foot.
Yeah, so we have a lot of
I don't know anyone who would do that to their newborn baby.
Yeah.
And
There's a lot of compression forces, but then there's also a lot of axial traction forces when baby is pulled out too.
So you think that could cause a little like irritation
Mm-hmm.
in their spine there?
I'd say so. I'd say a little bit. And so did the, what was that study?
Gottman?
Yeah, 1,000 babies that were born, natural, lovely, beautiful births.
Yeah, no C-sections, no forceps, no vacuums.
Over 80% had upper cervical subluxation, basically.
Well, correct. What we look for. What
Exactly.
our scans show.
So even with like really beautiful natural births, it can still happen. And so that's why we want to check babies when, especially if they're showing issues, then yes, yeah.
But that's what we call birth trauma. So birth trauma, a lot of people think of as a shoulder dislocation.
Or an emergency C-section. Like people, I think
that's very traumatic.
that's what they associate with like birth trauma, but it can still happen even with like lovely births.
Yeah, not like I just had a baby today, super like she was natural birth, really fast labor, and babies having these issues of like not pooping and colic and preferring one side to another, which are all classic signs of babies but also like a fast birth is also a pretty traumatic birth.
Yeah, exactly. So
there's a reason why they contract and it kind of goes slower.
right. So with those different pressures that go on in the upper cervical spine, especially, it's called KISS syndrome. It's kinematic imbalance of suboccipital strain. So basically, there's 3 little muscles up here that send a whole bunch of feedback to our brain, and that's how our brain figures out how our posture should be. It's called proprioception. So it's like how the signals that our body's giving our brain to tell where it is.
It's like the food for the nervous system is proprioception.
Yes.
Which is by proper movement of your spine.
Yep. So
joints, spine, everything.
When babies are born, it can misalign this area, so then they're not getting that good feedback and stuff too. So when we see babies with like really wobbly heads, really like poor muscle tone, that is usually kinematic imbalance, which is basically what it means, and suboccipital strain. The issues with that is that these nerves control a lot of the movements of the head and neck. They feed the brain all of that proprioception, which is really important, but they also control like the muscles of the face and jaw and stuff. So we see a lot of kiddos with like latching issues, or some like facial asymmetries, stuff like that after birth. Jaw issues, not being able to open their mouth all the way.
Or you see it like going to one side.
I'm seeing it like kiddo too that I've been seeing for a couple of weeks that we've been doing a lot of cranial work on him too, because he has a hard time latching, or he's like clamping down on mom's nipple when he's feeding, and a lot of that is because of the jaw strain, because of the birth process.
So even normal natural birth, babies should get checked afterwards, and we check them by doing the scans we do on adults.
Yeah.
Tells us how irritated their spine is and where exactly it's happening.
Yeah, exactly.
We're also seeing, I think we've said this before, but we're seeing a lot of stressed out babies in the HRB.
Yeah, so part of that is mom was pregnant through a pandemic, and that when mom's stressed out, she's releasing a lot of stress hormones, and baby's getting all of those stress hormones. So then it's born into an environment that it deems as being stressful. So that can make it.
Oh, I know. I was gonna say the big thing about having, because right, babies are fussy. People will go to their pediatrician and say it's normal for a baby not to poop for like 2 weeks if they're breastfed. We hear that all the time.
It's not.
Babies. And I do tell mom, babies do want to be by mom, but they shouldn't be like super uncomfortable laying on their back, or like, acid reflux is super common right now. So because common doesn't mean it's normal.
Babies arching backs, babies spitting up a lot, babies being fussy or wanting to be held or moved constantly.
Right.
Babies who are tight when they like are being burped too, or
just
like
if they're rigid in your arms. So babies shouldn't be like super like rigid. They should be more like fluid.
Exactly.
But the point of that was like, so people will think, oh, like, well, this is normal or it's common because everybody has it going on with their babies. But the problem then is if just covering up with a med or just giving them a laxative or something, is you're not correcting what's going on in the spine, and then the problem of getting stuck in that subluxation is they're getting stuck in that subluxation pattern and then that sympathetic like overdrive pattern, which is gonna cause issues down the road.
Yes.
You're gonna see allergies, you're gonna see asthma, you're gonna see ear infection, you're gonna see something in your child later on because the brain wasn't getting the proper brain food it needed, the proper proprioception. So it's stuck in
maybe
that
developmental
pattern.
issues, maybe not hitting their milestones or whatever it is, but
So that's why we always suggest mom get their baby checked early.
Yeah.
So we can fix things early.
Exactly. Because then we can kind of reroute some of the course of issues that are showing up. Yeah, exactly.
You don't want them to have patterns like we do as adults. They're harder to fix.
No, exactly. Yeah. So that's why when people come into the chiropractor for the first time in 50 years, and they're like, "This has been an issue my whole life." It's like, yeah, probably has been. So that was
my tangent. Sorry.
No?
Nothing else you want to say?
It's great. Let's talk about how we adjust babies.
Okay.
Too, because it was funny. I was talking to
Patient's husband.
Patient's husband who was his wife is pregnant, and he was like, I just can't imagine doing that twisting on a baby. And I was like, we don't do that. No one should be doing that. We do. So the way that we adjust infants, we use our fingertips. Their spine isn't fully formed, like the muscle or the bones aren't fully formed. So we're not trying to put in a lot of input on an infant's spine. The adjustment is really just sustained pressure, so we hold some tension against there, maybe a little wiggle, and what that's doing is sending proprioception to the brain. So it's not in the same way as like what we think of with adults when we're adjusting.
Mm-hmm.
I mean, we tend to lean more towards gentle adjustments even for adults anyways. But when we're adjusting infants, it's very, very, very gentle.
Yeah.
Like, you've probably seen pictures of us like with a baby and a pillow, like doing this move right here.
A scary baby.
Yeah, scary baby. With pen all over its face. Yeah.
Yeah. So, the other nice thing I think that we offer is after mom has baby, we will do a home visit. Check mom, check baby. I know it's hard to leave right after that. So the sooner you can get them checked. We've seen babies hours after. We've seen baby the day after.
Yeah.
Some moms wait a couple weeks.
Yeah.
We did have issues, but some issues people always ask, like, how would I know? Well, one, you should just get baby checked, right? Like anyone who has a spine should be getting checked. But and then how you would know if there is a subluxation usually is the latching issues, preferring breastfeeding on one side, not pooping,
I mean,
colic,
colicky baby.
not
Yeah.
the reflux,
Lots of gas.
not
pooping.
not burping.
Yeah.
Baby should be able to eat, poop, and sleep. If they can't do
Should
those
be,
things,
yeah.
then there's something going on.
Exactly.
So, all right. If you have questions, let us know. We'll answer them someday for you.
Yeah.
Soon.
Or in the comments or
If you want to know more,
we'll probably cover more on this topic too in the next couple of weeks.
Yeah.
But,
for sure. You can go
Yeah.
more in depth always.
All right.
Everyone have a great Wednesday.
Yeah.
It's a little warmer out today.
Spine magic.
Catherine told us that we have to smile together. All right. Peace out, everybody.